So I've been trying to active listen and also attempt to summarize all of the amazing information that's come out of our breakout sessions. It really seems like there's been some very thoughtful and robust conversations. And in an attempt to distill, I think my takeaways from what each of you have brought to the table are that this is obviously a multifaceted problem that's going to require a multifaceted approach to solve. We're seeing very clearly and very painfully right now how education levels and even exposure to diverse populations doesn't necessarily translate to cultural competency, that there's a deep need for greater levels of compassion and understanding to avoid the types of patient blaming that have led to inadequate and disparate care, the importance of the role of advocates in addressing those disparities. And really what stuck with me is the concept that health should not be a luxury. It's time to educate ourselves and take action when we see racism and be the change that we want to see. So in closing, I thought I'd bring a bit of Canadian perspective to the conversation. I know that I'm in the minority here, and that not everything necessarily applies across cultural divides. But I think one thing that does is that equal access to culturally competent healthcare is a key component and a necessary component in any just society. As our lovely opening speaker pointed out, there are many very firmly entrenched and interwoven obstacles in achieving that goal. And despite our polite international image and our universal healthcare system, Canada does have the same problems. Some of them just present a little bit differently. Fairly recently, we have committed to a social value that says diversity is our strength. And while that is a good place to start, we definitely need to walk the talk. One piece of that puzzle is the formal reconciliation process that we're currently undertaking to make reparations for past and present harms that are being done to our Indigenous peoples. I think it's fortunate that our Prime Minister has recently and very rightly acknowledged these harms that have included residential schooling as well as forced sterilization. And they've been recognized as genocide, which I think is a really critical step in the healing journey. Our reconciliation process began several years ago by addressing Indigenous peoples' rights to self-govern. And that's changed the nature of our relationship from really what was a parent-child type dynamic to more of a nation-to-nation type dynamic. So recognizing that this has been Canada's genocide, I think is a very critical step in our healing journey. Currently, the reconciliation process is focused on ensuring cultural safety and humility in the delivery of healthcare through various education and resource commitments. And I think that that's also a positive step. I do work for one of the many health profession regulators in the province, and our job is to ensure the safe and effective practice of various health professions through licensing. So even though we're not directly involved in the delivery of health services, as a group, we have committed to practice cultural safety and humility within the regulatory context. And we're working hard to figure out what exactly that means. We've created the working group to help guide us through that process. But more importantly, I think we have a top-down passion for this type of work. And our employer has provided us with the opportunity to take some cultural safety training, an online facilitated program that does a really great job of explaining the impacts of colonialism and ask participants to examine how both the colonial context as well as their own personal beliefs are contributing to systemic racism in the delivery of healthcare. And I think it's also fortunate that this is really just one of many resources that are available to us on the topic. However, even with that wealth of resources and the willingness to participate and affect positive social change, the wheels turn very slow. And that's one of the things that I think several breakout groups talked about. It's a difficult task because it's a big one. We have to undo years and years and years of systemic problems. And, we need to take the time to educate ourselves about the people who are in our communities. So in that context, we've become painfully aware that we just don't know what we don't know. And it's become really hard to identify the right people to help us in this task, especially when that involves reaching outside of our own communities. That said, I wanted to try and end our meeting today on a positive note. I'm I'm really hopeful that when we're all united by a common social value and have a common social goal, and that there's a willingness to change, that nothing is impossible. And I do believe that government plays a large role in setting those values and holding itself and its citizens accountable to them. And I think that groups like this, people who are passionate about social change, play a key role in that as well from a ground up perspective. So thank you very much for allowing me to participate in this group and to provide some closing comments.